We're here today to talk about a problem that affects over 25 million people in the U.S. This problem is asthma, and it occurs in every city in the country. Asthma is a respiratory disease in which a person's airways narrow and swell, making it difficult to breathe and causing coughing, wheezing, and shortness of breath. Asthma is really common. About 1 in 11 American children has asthma, and the disease costs the U.S. over $50 billion each year. The disease can be managed with medications like inhalers and by avoiding the various triggers that can cause asthma attacks, but it can still be really dangerous. In 2009, there were almost 2 million asthma-related visits to the emergency department. Sadly, about 9 people die from asthma each and every day. The problem is getting worse. Over the last 10 years, the number of people with asthma in the U.S. has increased by 15%. To tackle this problem, let's look at what causes asthma in the first place. Did you know that the pollution from highway traffic can increase a child's risk of developing asthma? Scientists have known for a while that the emissions produced by cars and trucks can make a person's asthma worse. More asthma attacks lead to worse lung function and more doctor visits. Now, researchers are finding a lot of evidence suggesting that children who are exposed to high levels of pollution are not only more likely to have problems with their existing asthma, but are also at an increased risk of developing asthma in the first place. So what can be done about children's asthma? Cities across the world have taken steps to tackle this complex issue. The problem can be viewed as inevitable, and so we could focus on decreasing the negative effects. Let's fix the pollution that's in the air already. Or you could tackle the issue at a smaller scale by encouraging revenues at the household level. Things like air filters for your home air conditioning units can provide air quality inside your house. If you live near a highway, you are likely experiencing increased levels of air pollution, and filters are a step you can take today. Other areas try to handle the existing pollution on a larger scale by limiting land uses that are around highways. These strategies try to decrease the effect air pollution has on vulnerable populations. Some cities say that schools or housing can't be built near highways. This approach is wise, but is difficult to do in crowded areas. But the smartest way to tackle this problem may be to decrease the amount of pollution that's in the air in the first place. This way, we wouldn't need to worry about who lives or plays near highways. The air would be simply cleaner and easier for all to breathe. Some cities try to address this issue on a large scale. They try and decrease the use of motor vehicles across a region. It's pretty simple. If people drive less, there will be less air pollution around highways. So cities then try to encourage walking, biking, and the use of public transportation instead of cars. While it may be hard to think about how your car trip across town affects asthma for your neighbors, a great example of reducing trips and reductions in asthma occurred in Atlanta in 1996. In preparation for the '96 Olympic Games, Atlanta officials put in place controls to limit the amount of driving. They wanted to ensure better air quality for the world's top athletes. Due to the Drive Less campaign, motor vehicle traffic decreased by 23% at peak travel times. During the same time frame, Medicaid emergency room visits for asthma dropped by 42%. This is a really significant decrease. This Atlanta example in asthma shows us that it's possible to reduce asthma complications by tackling transportation pollution. In summary, we know that driving leads to increased pollution, which leads to increased rates of asthma for children living near highways. This is a big challenge. Making cities pedestrian-friendly using air filtration systems and driving cleaner vehicles can seem like huge projects that could take decades to tackle. Luckily, there's something we can all do about this issue today. We'd like to challenge you to think about the trips you take by car during the month of May. Think about the health effects that each trip you take might cause for your neighbors living near a highway. Is there another way you can travel that day? What public transportation options are available? Can you ride with a friend or carpool? Would it be easier to ride a bike in the warm weather? If we can all take just one less trip every week, that can make a big difference. We hope that you take this challenge to help create better air for your neighbors. Let us know in the comments section which steps you took this month. Good luck!